Welcome to a quick guide on coronary angioplasty, also known as percutaneous coronary intervention. This procedure is done on blood vessels called coronary arteries, which supply your heart muscle with oxygen. The goal is to restore blood flow if plaque has significantly narrowed these vessels. To begin, the doctor will numb the skin in your wrist and place a needle through your skin and into your radial artery. A flexible guide wire will be passed through the needle into your artery and then exchanged for a small flexible tube called a sheath, permitting access into your artery. The doctor will advance a catheter to your coronary arteries and use a special dye to view any blockages in the artery. If a significant blockage is found, a balloon on the tip of the catheter will be used to expand the artery and improve the blood flow. A wire mesh tube called a stent may be placed in the treated area to help keep the coronary artery open. And that's it, a life-saving procedure to restore blood flow to your heart.